Virtual Consultation version 12.3. And my name is Robert Rocha. I'm the owner of 3D Practice, and I'm going to demonstrate our latest version of Virtual Consultation. So over here on the left-hand side, these are the different categories of animations, and that's one of the strengths of the tools, that everything is 1 to 2 clicks away. There's not a bunch of pull-down menus and scrolling that's involved, especially when you want to quickly show that patient their condition and how you're going to treat it. So everything is very accessible, 1 to 2 clicks away. There's also a drawing tool on the right hand side, allows you to draw whiteboard on top of your animation. You can capture your work, whatever you're showing the patient, by clicking on this button on the right where it says capture. That'll take screenshots. Then when you launch the report, you'll be able to generate a report very quickly with care plan exercises, as well as the graphical content that you've shown them during that report of findings. There's also some more animations that have a graphics engine built in, which gives you that power, that flexibility to turn and zoom in and look at things from different angles. There's some built-in videos, so if you want to run this in a passive mode, you can do that. And then going down to this second to the last icon, sources. So when we click on some of these animations, you can click on the source button and it'll tell you where we got our information from. So if we go through a demonstration, and I'll also touch on some of the latest stuff. Let's start with the disc ailments. That's a great place to start. Everybody deals with disc conditions. And over here we set up this set of animations like an MRI, where we have a lateral view on the left and an axial view on the right. So very, very easy to show a patient whatever they have. And then here we're showing a left lateral bulging disc, but if we want to switch it over to a centrally bulging disc, we can do that. If we want to change that to a, let's say, a posterior lateral herniation with free fragment, you can do that as well. When I click on this little book on the right, it'll tell you where we got our information from. So if we go back to a left lateral bulging disc, we can also whiteboard onto the screen. So if a patient does come in with their MRI, a lot of docs just read off the report on the MRI and they go right to this graphic, explain what that MRI means basically. And then they could talk about how they're going to treat it. So if they do some tractioning or possibly some flexion distraction, decompression, spinal adjustments, whatever it is, you can whiteboard on there. Patients love to be educated in that manner. And then you can let them know that you can get the pressure off that nerve and possibly get that disc to retract as well too. So that's just one example. Spinal adjustments, there's a spinal adjustment animation in here as well. So, again, patients love visuals, and all they know is that, there's a force applied to their back or their spine, cervical spine, and they maybe feel some relief, but this one actually demonstrates some of that functionality. So we can mobilize that joint, possibly get the pressure off the nerve there too. If I click on another one, let's click on degeneration, we can bring that up, and that's going to bring up a set of animations side by side. We do a lot of side-by-side animations, and in some cases we'll actually have an animation of an x-ray too. But we can show things like good cervical curvature. We can draw on the screen. We can illustrate what good cervical curvature should look like and emphasize that. And then we can even kind of go through the different stages of, in this case, cervical degeneration. If we want to switch it to lumbar degeneration, it's just 1 click away. Likewise, the other thing we can do here is just click play. What's really interesting about this animation is that it shows the spinal cord on the right-hand side, and you can see those nerve impulses traveling, and they slow down as the degeneration gets worse and worse. So we know that the nervous system can be affected by degeneration of the cervical spine. And then we can go over to any of the symptoms charts or nerve charts. So the original dermatomes charts in here, the myotones charts in here, peripheral nervous system chart is in here as well too, and the original autonomic nervous system chart is in here as well too. So there's also a newer organ chart in here, newer nerve chart. And what's really cool about this is that this one allows you to show in a 3D manner, an interactive 3D manner, that same organ chart. So we can see, it's going to pop up here, and we can go ahead and take a look at this. And you can see on the right-hand side we have the different vertebral segments. There's a scroll bar that may just be out of your view there of this capture, but you can see the nerve impulses are flowing from the brain down the spine over to the organs and back. But if there's a problem associated with the C1 vertebrae, that could affect all the different organs and body parts. Likewise, if there's a problem with, let's say, C6, that could affect the thyroid. C2 could be some of these glands. We can go down to T2, which is the heart. And then again, it's very interactive, very cool. You can show the patient. All these organs are actually individual 3D models as well too. And again, we can go all the way down to the lower lumbar segments in the sacrum as well too. So doctors really love this feature. It's similar to what they may have on their wall in the way of a poster, but this just gives you so much more coolness and functionality. So lots more stuff. Pretty much any spinal condition, extremity condition you could see. Here's another one. We'll just click on upper cross and lower cross syndrome. That's going to bring up basically a set of animations with a posterior view and a side view. We can show basically upper cross, and here are the muscles that are affected by it. Some of them are going to become tense from being in that position too long. Others can begin to weaken because they're no longer engaged. And then we can show lower cross syndrome, which is basically it's hyperlordosis and what it does to the muscles. And then we can even show the loss of curvature as well too. So this is actually an older animation that we put back in there because so many docs really liked it. But it basically shows upper cross syndrome on the right-hand side, and it shows sort of the details of the cervical X-ray as well too. So. Now, if we move over to the right-hand side, again, there's the drawing tool, which we've seen. There's the ability to capture these images and generate a report. And I'm going to do that. Tell you what, before I do that, let's go ahead and just click on one more set of animations here on the right-hand side. So if I click on the 3D interactive stuff, it's going to bring up another interface. And this is going to allow us to show things like cervical whiplash, 3D dermatomes, 3D sclerotomes, and the trigger points, 3D trigger points, and show how interactive they are. And it's a cool perspective to have this, and not too many other products on the market actually do this. But take the case of a rear impact auto collision. So this is totally interactive. I can, if I have a touch screen, I can use my finger or a stylus, or we can just use the mouse. And we can go ahead and play this. If we want to draw on the screen and illustrate the forces, we can. I'm just going to step through the animation and we'll see what happens. So we'll go ahead and click on play. Let's pause right there. We can see the thoracic spine is straightening out. The body's lifting upward. You have the shearing forces from behind. That's creating the S-shaped formation in the cervical spine. Hyperextension, hyperflexion. And then we can zoom right in to the cervical spine, and we can see things like C4 vertebrae is slid forward. Let's turn it around to the back and see why. Well, look at that. There's tearing of the facet capsules on both sides, also tearing at the PLL. We can go up to the front side and see there's some tearing of the anterior longitudinal ligament as well too. So again, totally interactive. Docs that are doing personal injury, quite a bit of that, absolutely love this particular feature right here. And if we click on some of the other ones, I showed you the original dermatomes we did a long time ago, but over here we can see there's an interactive version of the dermatomes. So we can click on, let's say, the C8 nerve. You can see those patterns. We can also click on, let's say, the L4. We can see how the patterns wrap around the body as well too. And then we can go over to things like the trigger points as well. This is one of my favorite features because the trigger points is very difficult to do. Again, totally interactive. We can zoom in. When you move your mouse cursor over any of these trigger points, it'll tell you what muscle that trigger point is associated with. So if we click on this one, that's the pectoralis major. We can see the pattern, the trigger points, and the corresponding muscle as well too. If we click on the thigh over here, that's the vastus intermedius. We can zoom in. We can see that. Excuse me. We'll turn it around to the posterior side. We can click on the piriformis. Now you also, on the right-hand side, there's a sprocket there, maybe just out of your view, but we can actually adjust the color intensity, or we can change it from red to blue as well too. So those are some of the interactive ones. There's also a sclerotomes model in here as well, and we can click on, let's say, C7, and we can see the corresponding patterns associated with it as well too. So I'm going to close that down, and why don't we now go ahead and show you just one more animation, and then we will go ahead and generate a report. You can actually email the report as well too, which is very cool. So there's one more animation. It's actually one of the newer ones that's in the product. It's the ligament injury animation, and basically, and again, this is another one. You know, if you're doing personal injury work, this is going to be great. If you're not doing much of it, you may still see this condition. So what we show basically is The posterior longitudinal ligament is no longer tight, so you have a little bit of ligament laxity there. There's been some type of injury. Maybe there's a little tearing there. Maybe it's just stretched. And then we can continue to advance this animation, and you can see when this person goes into flexion, there's going to be hypermobility of those joints. So look how all these segments up above where that injury is slide forward, and you can see the angle that gets produced by that. We can bring that back, and we can also click on, let's say, extension, and see the same thing happen, except this happens when we go into an extension. So the ligament's loose, it's damaged, and then during extension you may have hypermobility there. And then the same thing when we have the head go towards the right shoulder. Look at the C1 vertebrae. Everything is fine until all that weight of the head is applied to it. We get to that angle, and you can see the C1 vertebrae is now hypermobile there. So we'll close that down, and why don't we go ahead and generate a report. So if we go ahead and click on, let's go back to the disc ailments feature, and let's say a patient comes in, maybe they come in with an MRI, maybe you do a functional test, maybe you order an MRI. Whatever it is. There's so many docs out there, of course, deal with disc conditions, or whether you're doing decompression or flexion distraction, you're adjusting, you're mobilizing the joint. You can use this tool to explain all that. So, and what's cool about it is while that patient is sitting there, you can be clicking on this capture button, and while they're shaking their head, yes, I understand, this makes sense, you're capturing this content, and it gets thrown into the report for you automatically. It takes about 60 seconds to generate a report. You can save it off, you can print it, give it to the patient, you can even email it as well, and you can do all of the above. So you can email it directly to the patient now within virtual consultation. So if we like this animation, I'm going to go ahead and click on the capture button here. It's taking a screen capture of this. So we've got one of those, and let's say we also want to explain to the patient how we're going to treat it. And maybe they're a good candidate for flexion distraction. You're going to let them know you're going to apply these forces manually. There's a lot of research behind it. And we're going to get that disc to retract, take the pressure off that spinal nerve. So this is great for acceptance, advancing patients to care. And the other thing too is you want to make sure you have good compliance, right? So you want to let that patient know that there's a process of healing. And we know that, you know, from this technique, it takes X number of weeks, so many sessions per week. And we can get this disc to retract, take some of the pressure off that nerve, alleviate their pain, and you can do it without drugs and surgery. But it's important for the patients to understand compliance is not good, you can come right back to here. That disc takes a certain amount of time to heal. You want to strengthen the ligaments and the muscles in the surrounding area as well too. So that's also good for compliance. Let's take another screen capture. We did that. Now at this point we can go ahead and launch the report. So with one click, the report's going to pop up. We're on version 3.0 of the report. And this is what's really cool about this latest version of the software. Again, we're on version 12.3. We've added, in version 12.1, we updated the report so that you can email it directly to the patients. We've also enhanced some of the existing graphics as well. So if we go ahead and type in a patient's name here, let's just type in a fictitious name, Tom Smith. You put in your logo, and in this latest version, you can actually make your logo, or put your logo in any format. So it can be JPEG, it can be bitmaps, it can be PNGs, whatever you have. Trying to make it easy for our customers, obviously. So the name of your practice, contact information, where you can be reached, a description of your practice, all of that in there, and then an email address. So, and I'm just going to type in my Gmail account, email, and we're going to close that up. Now, the next time you actually open up this report to generate it for a patient, all your information is in there. Your logo, practice name, practice information, and description of your practice. The two pieces of information you have to put in every time is the email and the patient's name. Again, it's designed to be something you can generate very, very quickly, 60 seconds or less. In this case, the patient had a disc condition, so we're going to go ahead and check off some things. So let's say you generated in bulging there, and maybe it's herniated there. You can go ahead and scroll back up, close that up, and we can scroll down. If there's no other conditions, let's say there's SI joint conditions, you can check off imbalance or inflammation or degeneration. If there's knee or shoulder, hip, elbow, wrist, foot conditions, we cover extremities in this product as well. And then you can also open up the image gallery. And here you'll see a thumbnail of those images you captured. You can capture up to 8 images. And if you capture one you don't like, just click on the X and that'll go away and it won't be in the report. Treatment plan. So here you can go ahead and customize it. Any language you want as well. You can go ahead and change these names. If you want it to be in Spanish, you can change these names here. If you just want to change the nomenclature a little bit and just use different terminology, you can do that as well too. So you can do that, and let's leave the rest of them the way they are for now. Comments, you can create all the custom comments you want, and this is where you can put in things like, hey, I want you to do this amount of icing every time you go home after you do these exercises we prescribe. I want you to take these nutritional supplements. I've got doctors that have put pricing packages in here too. So comments are really a section where you can just put whatever you want to put in there to help educate that patient. And I've got a couple of just one-liner comments. Again, once you create these, you can just reuse them over and over again. I've got a couple of short ones there. And then I'm going to go ahead and scroll down further. Let's see if we can do that. Bring up the exercises. There we go. Okay. So, and we've got exercises now. Cervical stretching and strengthening, lumbar stretching and strengthening, and ball exercises as well too. So we can just scroll down, whichever ones we like. You just go ahead and check them off. Specify the hold times, repeat times, number of times per day, and we're done. So at this point, we can go ahead and generate the PDF. I'll just click on that little button right there. It says PDF. And I'm actually going to go ahead and email that to myself. Would you like to email this report to Tom Smith? Remember, we put in his email address, actually my email address for Tom Smith. So I do believe I have an email coming in here. Let's just see. Okay. There it tells us that the message was delivered successfully, and there it is. So we're going to open up this report. Again, it's going to be in a PDF format. Your logo up top, practice name, practice information. The first page is all about your practice, and it automatically grabs the date from the computer as well. The patient gets this again. It's going to have information about their condition, all those graphics that you showed the patient. The patient said, yes, I understand. Thank you for showing this to me. This is great. That's going to be in the report as well too. And then the treatment plan. So second page is about their condition. Third page is this is how we get you better. We're going to put you through these phases of care. We're going to have you do these things at home. And here are the corresponding exercises as well too. So with that, I think I'm going to go ahead and close up the demonstration of virtual consultation. Again, this is version 12.3. If you're an existing customer and you want to learn how you can get the latest version of the software, feel free to give us a call, 866-399-4009. You can also email me. My email is robert@3dpractice.com. And I'll be glad to help you out. And if you just want a demonstration of the product, maybe it's new to you, you haven't seen it yet. But again, it's been designed for that 5-minute report of findings. Everything is very quick, easy to get to. Your staff can use this product. There's a number of offices that I have that are using this, a number of customers, and they have their staff do this session basically. So the doctor will tell the staff member, go ahead and show them a subluxation, show them sciatica, show them what poor posture looks like, show them degeneration in the stage 2 of cervical degeneration. So, and generate a report form as well too. So with that, I think I'm going to go ahead and close up this demonstration. If anybody has questions, again, feel free to give us a call. Again, my name is Robert Rocha with 3D Practice. Here's the phone number, 866-399-4009. Thank you.